All right, Valerie, thank you um, for allowing this to be put on YouTube. But if you don't mind, just because I do know you from treating you before, do you mind giving a little summary of sort of how you ended up coming to me and what I've helped you with?
Oh, sure. So I had a head injury 3.5 years ago, and pretty much wiped me out, and I couldn't exert myself at all without having really awful symptoms. So that was for 2 years. I was in that place of very low functioning, and then Melanie worked on me, and I went. I mean, it was a huge transformation. In fact, I was able, and I still can, invert, right, since that treatment, which I hadn't. I mean, I couldn't even practically touch my toes without getting symptoms. So I'm still inverting and everything. And Melanie's worked on, helped me, with ongoing kind of healing from this. And now I just had some, and with other things, and the exercises that you have prescribed to me, when I could just send you a text and say, like, oh God, my left shoulder is all seized up, and you send me an exercise that works. And then that vagus nerve thing, when I texted you a week ago or so, and I'd already been symptomatic for a couple of weeks, sort of, a little concussion-y symptoms, head buzzing, but also like my shoulder and my pelvis and my ankle all the way down, like my whole body just went out. And I did the vagus nerve exercise, and I had a huge improvement in most of my body, a huge improvement, and except my ankle has remained really extremely painful, so that's kind of where I am right now. And those other things that I maybe didn't do the exercise as much as I should have. That one with the sound, but it did clear it up enough for me to become functional again.
Good, good.
So I feel just like little bits still in the shoulder, and like it's a little bit uncomfortable, but the ankle is like really, really strange.
Okay.
And that's new. So.
Okay. All right. So first, I just want to go back to, because when you came to me initially, you were unable to work, and you had a pretty fast transition in being able to not work and being able to go back to work, as I remember.
Absolutely. I mean, like within like a week, I felt so much better that I jumped in and got 2 jobs.
Yeah.
Right?
So that's a huge thing. And like women get labeled as catastrophizing for concussions, and having somebody, you had a lot of cranial dysfunction, and, and it was not difficult to correct, but it just needed it needed to be done, and that's one of the really, I just wanted to highlight that because that's one of the really magical things. And I've had multiple people with concussions that have had a very similar response like you.
Yeah, so it was dramatic. Really very, very dramatic.
Awesome. Yeah, no, I remember it being dramatic as well. Now, just in the interest of sort of, for people who are watching this, can you just like move your shoulder and maybe like come up on your toes, or like do something that provokes your ankle, just to kind of give it a little test?
Okay, well, just sitting, I'm in pain, so
okay.
Let me see, what should I do?
Well, for your shoulder, just lift it overhead and see.
It's because I habitually practice yoga all my life. I can
Right, you're pretty flexible. What if you come out to the side like this and go down? Is that?
I mean, then I can really feel the discomfort there.
Okay. Well, you've got them. Okay.
But anything I do on my ankle is.
Okay. Can you stand on that ankle? Stand on one leg?
I can stand on it.
Okay, now stand on your other one. Okay, so you see how much more solid your balance is on that.
Right.
Side. Okay, well, I just wanted to have a little before and after. Okay, you can get comfortable.
Okay. Get back in bed. Okay.
All right. All right, so left shoulder, left ankle?
Left shoulder, left ankle, whole pelvis. I've also been, having a lot of sleeplessness.
You feel, well, let me ask you this. Can you feel my energy yet?
I can feel your energy moving in the center of my back right now.
Yeah, I feel like it's really in your solar plexus area, you know, or like that center dive, you know.
Right. Oh, interesting.
So you're feeling it on the back side of that?
I'm feeling the backside, like a little bit up from the solar plexus, just a little bit.
The there it goes.
Now I can feel it on the front and in my arms as well.
Yeah, you had a good release with part of that. Okay, that feels better in your center. Does that?
Definitely. It's wild. It feels like I'm like a cool cloud coming in and moving through.
You're so fun to treat because you respond just ultra quick, you know, or
Really?
and the, you know, and part of that's, you know, that's largely I say because you do connect with yoga and other spiritual practices that I think that sometimes makes it a little bit easier. Did you stand back up or are you laying?
No, I haven't stood back up.
Okay. All right. No. I was just saying, all right, because I'm going to go to your ankle
Okay.
next. Oh. All right. So it's interesting in your solar plexus, you had you had just sort of a structural piece and you had some energy there that was not yours. That needed to be cleared out. But I think part of it was diaphragm and part of it was that energy that needed to be cleared out. Okay. Yeah, you've got somebody else's energy down in your foot too. Like there's, let me see if there's a structural piece. No, it's just.
That's so weird.
So maybe what I'll talk you through after this is a little bit of ritual for clearing your own energy, maybe morning and night, so that you have, so that you're not so sticky. Because I know you're sensitive to energy.
Right. That would be great.
Oh, there it goes. Huh. How does your ankle feel? Is it
Yeah, it's still super tender to the
okay?
touch. And,
What part of the where is it tender?
so here, can I show you? Can you see? So this, it's like here.
You're okay. I can't quite see. So like the top of it?
Yeah, it's like on top of my ankle,
Okay.
like this area.
Okay. Oh, all right. It's the ankle tenderness. It's not coming from your ankle. Okay. How's that? Did that shift it at all?
I mean, like as I'm sitting here, like normally even just like sitting like I am right now with it
Mhm.
up, it hurts. So I feel a little less, but if I touch it, it's still super
Okay.
tender to the touch.
Hmm. Well, and remind me if I'm correct, because you feel like you have a big line of tension between the right side of your head and your left ankle, but your impact from the concussion was the right side of your head, wasn't it? Do you remember? I only
Um, I think what it was that I hit the left side of my head, and the whiplash was like from the right neck, so
okay.
yeah.
I remember when I remember specifically you were really stuck down at the left, but I couldn't remember if that was the impact or the. Um, I was thinking the impact was on the right and had left you stuck down on the left. There we go. Hmm.
It spiraled through my whole body, like left head, right neck,
Yeah.
left shoulder. It was like this, like all
Yeah.
the way.
No, it was super messy for sure.
Yeah.
Yeah. And you definitely, I mean, when I worked with you at first, we met in person. And I think that, when you have that kind of an injury, sometimes it's really helpful to have the in person like the hands-on part of it too. Although I've gotten so much better at this part that I'm less seeing the need for it. But I do think there's value when you've been, really had a lot of physical trauma to.
Yeah, so it comes up, like the same symptoms that I had for those 2 years come up on occasion when things get really stressful. Like I can
Mm-hmm.
go a while feeling really fine and like I'm
Mm-hmm.
told, and then all of a sudden it's like, oh,
Okay. How's your ankle?
maybe it's a little less tender.
You did a good job on your ankle. You've got a lot of different layers of energy there.
Well, it's really strange because it was like it hurt a little when I had all that other stuff going on, and then all of a sudden yesterday it was just like boom, like really, really inflamed and it was almost like because when I told you my left shoulder. I mean, I was really like could hardly move last Friday and Saturday with my shoulder, and
Mm-hmm.
then I did the exercise, and it's like the intensity of what was happening in my shoulder like moved down to my ankle or something. I don't know.
I might buy that based on how it feels.
Yeah, like like it moved out of here, but then
Wow.
it's like all of a sudden that part got much worse or
Mm-hmm.
something.
There we go. Is that shifting?
I feel my whole body shifting.
Mhm.
My nerves calmed and more spaciousness inside. And I think my ankle is less tender, but it's definitely still.
Yeah. Well, you've got it. So
It's
I just want to
like,
make sure we're heading in the right direction.
yeah, 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 yeah. But it does.
Well, it was interesting because it's almost like your ankle, like when I finally just went into like I was like, all right, well, show me what your tibia looks like. And your fibula, it's almost like you've got like a severe compound fracture in there. Like
Huh.
the energy's all misaligned. And, that could be it feels more like a past life sort of issue.
That's really interesting. I actually was thinking I would go to the urgent care in the next couple of days. Like I
Yeah.
was like today, I was just like, okay, if I'm not feeling some relief, I'm gonna go have an X-ray. And but I remember something about a past life with my left leg being lame or something.
Interesting.
And then like as when I remember like kind of having a weird thing with it being a little off when I was swimming as a child. Getting energy moving through it was weird.
Okay. Let's recheck and see.
My energy is so much more settled in my body than when we started. It's wild. And I can see how kind of on high alert I've been somehow.
Yeah, well, we don't often realize we're stressed until we get calm, and then, or some of that goes away. Okay, now I'm going to go up to your head. So it's like your palatine bones make up the back part of the hard palate in your mouth. And they're sort of like gates, and they kind of look like a gate. And your gate's all collapsed.
Mm.
At least energy. I'm sure if they x-rayed you, it would look just fine. But
Well, I mean, how much more I'm settling into my body right now is wow. Oh my gosh.
So it was like your mind, body, and spirit, and thought, word, and deed was all in a billion places. Like it all.
Mm.
You had
that sounds right.
that you had multiple segments of your energy that were not. Okay, tell me how that feels. I feel guided to at least pause. If not.
Wow. Well, first of all, at the moment, I'm feeling quite a bit of heat. In the beginning, it was like this cool cloud, and now it's a lot of body heat is rising, and I feel like I just arrived home, like I was in a spaceship gone or something.
That's
yeah. Yeah. So I'm just feeling pretty.
That's a fair. Well, and that's good to have that heat as the release, because that means the stuck energy is moving and is exiting. Like, to me, when people get warm, that's an excellent.
Yeah. No, I mean, it's extreme. I feel there's heat all over my body, except maybe not in my ankle, which is strange. My ankle feels cold, but like the rest of me, like in my trunk, and I feel like really, good.
Okay. Do you feel like you could get up to check your shoulder and your standing balance again? Sure. Let's see how that is. Can you put the camera in the same spot so we can see it?
Yeah. Okay. Okay.
Okay, so you said it bothered you when you came down.
Yeah, well, my shoulder feels totally fine and good.
Good.
And my neck.
Good. Now stand on your left leg and let's see what that balance is like.
I'm afraid to put weight on it because I've been like limping around for like a couple weeks.
Yeah. Well, how does it feel? Just walking.
I mean, it definitely feels different, yeah, remarkably. And maybe I'm just not, I've been keeping the weight off of it for so long.
Sure. Well, you're going to be a little unsteady, and everybody's got a side that's a little bit better than the other balance wise, but that looks better than when you're not doing quite so many, your arms were, I think the first time were flailing. I'll have to go
Right.
back and watch. We're flailing more. Stand on your right leg again, because I know that's your good one, but just. Okay, and now go back to your left one again. Much better, huh?
Yeah, well, I mean, I think I'm bearing weight better for sure.
Yeah.
And, at the moment, like there's so much heat in my body. I'm like, whoa.
All right. Well, I feel like I feel like that's kind of what your body can handle for today. I know when when my hands get guided to come together like this, I feel like it tells me not to mess. Don't fix what isn't broken.
Right. Well, thank you so much.
And that's definitely, well, awesome. Thank you for sharing your story with this. And as always, it's fun to work with you.
Do you want to do this with the recording with the energy stuff of clearing my energy? Or do you want to do that another time?
What do you mean clearing your energy?
Well, you were saying you were going to give me an exercise just so that.
No. Thank you for reminding me. Yeah, no, let me do that. Hang on one second.
Because I am super sensitive and can be spongy.
Mm-hmm. Okay. So first, I think you should sage yourself, especially at night before you go to bed. Like all, along your, like outline your body. And you can even, spiral, if you can pass it around. And if you are able to, really be sure to if you can, get the back side of your heart.
Okay.
And do you have a selenite wand?
I do.
Like this? Yeah.
I do, and I've never used it ever.
So yeah, use it to cut your cords.
Okay.
Just from interacting with people. And again, backside of the heart, huge sticky area.
Okay. Got my wand.
Yeah, yours, I know mine's, I have a little teeny one. I need to upgrade my wand. But I think especially before you go to bed, the saging and the selenite. And I think it's good to do, I think you could do it even in the morning too.
Yeah, because sometimes I'm waking up with a lot of anxiety, like waking up.
Yeah.
Like, whoa, Yeah.
And then, and I know it's going to sound super silly, but I think just to keep kind of your channels clear, and this has been one of my favorite things to do recently, is to, if you have two little balls, to put under the sole of your feet and just rub on the ground. For your feet. And if you have, like, this is just a little head massager thing.
Oh my gosh.
And I know it's silly.
I have one. I love that thing. I haven't seen it in months. I don't know where mine is, but I got to find it.
Yeah. But I would like do your head and your feet so you stay, so things can move through.
Very good. Excellent. Thank you so much. It sounds really.
I think the sage and the selenite are huge. But I think
never think of, thank you. It makes perfect sense.
Yeah, but I think if you did those things in combination together, that you would really feel like things were moving through you and not getting.
That's so amazing. For the last 2 weeks, I've been like, I need a better bedtime routine, but not able to even think of what it could be.
Oh, I get it. It happens to all of us. It happens to me too. When you try, even I go, oh, I should do my own exercises that I teach, and I'll feel like this making me feel better. I've gotten a lot better at like now I'm like, all right, I'll just fix it. And then just at treating, slowing down enough to treat myself. And do the bottom when you sage, and when you use the selenite, do the bottoms of your feet too. Okay, so that you're lifting your foot up and,
right,
you know, getting the bottoms. So.
Okay. Sounds great. Thank
All
you
right.
so much.
You're very welcome. Tell you what, since you've had that for a second, I just want you to stand up and just where you are and stand on your left leg and see.
I see.
What you think.
I mean, just walking is more comfortable. I mean, I was really limping today and yesterday.
Do you feel like you're limping right now?
Not right now. I'm actually pretty well bearing the weight with a little bit of discomfort, but not like it was earlier today. Let's see if I can stand on my, that's pretty good.
Yeah. Definitely better.
Yes. Yes. Thank you.
You're very welcome. Thank you for reminding me of that last part. And we'll, let me know how it goes.
Okay. Thank you so much.
All right. Thanks, Valerie.
Okay.
Bye.
Bye.